Amherst doctor Eugene Gosy became one of the faces of the opioid crisis in Western New York when he was charged with illegally prescribing painkillers. And tonight, prosecutors say some of his patients died because of that. Good evening, I'm Mary Alice Demler.
And hello everyone, I'm Scott Levin. The feds laid out the additional charges this morning that Dave McKinley reported last night. And first on 2, he joins us live with details on this story you saw first last night. Dave?
Well, this is, according to the U.S. Attorney's Office, the first time in Western New York that a physician has been charged with illegally prescribing medicine, which then resulted in the death of a patient.
We only have to show that the unlawful distribution resulted in a death, and then there will be liability.
Prosecutors allege that starting more than 10 years ago, Gosy orchestrated a conspiracy along with employees at his pain clinic to provide more prescriptions for controlled substances than any facility in the entire state, including hospitals. In some cases, they allege he overprescribed. In others, that he prescribed haphazardly without even examining patients. They even accuse him of having signed blank prescriptions to be filled out by staff while he vacationed.
That's irresponsible, and as alleged in this indictment, that's illegal.
Perhaps more importantly, though, when it comes to their task, prosecutors allege Gosy failed to pick up on or ignored obvious signs of addiction among patients, including that they'd overdosed before, or in some cases, turned a deaf ear to their loved ones who urged they be given no more meds because they were hooked.
Family members for some of the victims even went to Dr. Gosy and basically asked for help, that my family member, my friend, is addicted. Do something to help them. And what was done is borne out by the subsequent conduct was that person was given more drugs.
Prosecutors allege Gosy's actions resulted in the death of 6 of his patients. But Gosy's attorney says those deaths, while tragic, are not the fault of his client.
You try and relieve people of the chronic pain that they're having, and if they want to abuse these medications, we're not the one to blame. Maybe the government should look someplace else.
To me, that's blaming the victim. These are people that are sick, whose judgment is impaired, who are being prescribed drugs which have a pharmacological effect, which impacts, brain function. And to say that somehow it's their fault, for example, one wants to lose weight, and they go to a doctor and they say, I really like chocolate donuts, and the doctor says, well, great, here's 12 dozen chocolate donuts, but only eat one at a time. Is that really the patient's fault? Or is that something in the manner in which the doctor, or in this case, the donut provider, the blame lay at their feet?
Dr. Gosy, who had originally been indicted on more than 100 counts a year and a half ago, has yet to be arraigned on the charges found in this superseding indictment. He can no longer prescribe medicine. However, he is still prescribe drugs, rather. He's no longer allowed to write prescriptions, but he is allowed to practice medicine, but only under the supervision of other doctors. By the way, if convicted of the most serious charges he now faces, it could equate to a lifetime behind bars for the 57-year-old physician. Live in downtown Buffalo, Dave McKinley, Channel 2 News.